Bowhead Futures presents digital health at the front lines. We explore how healthcare is shifting by deep diving with the doctors transforming the system from the inside out.
So I'd love to hear what you think from a patient perspective, because, to me, it makes me think like people must be completely overwhelmed to see that there's been so much automation, so many changes happening. I know that, my mom, as an example, hasn't left home and hasn't been going to see her doctor, out of fear, and also doesn't have the I guess the motivation to or the experience to use online methods or virtual methods. So I'm curious how patients are reacting to this move to digital, and given that there are so many different types of patient groups.
Um, my parents, like the example of your mom, have in a similar position. They get overwhelmed. Something as simple as accessing lab results online. You need to download an app and then pull it up in a PDF. In some cases, it doesn't work on a phone, and you need a laptop or a desktop. And I can see why that's very confusing, and I can appreciate that. And we have to be very cognizant of how fast you roll out this technology as well, because the whole point of everything we do in healthcare is to improve health outcomes, right? And if we're banking on the fact that folks in this demographic will learn how to use IT services at the same rate as someone who's in their mid 30s and who's grown up in a culture that is IT centered, we may have to build scalable solutions that take into account this factor of it. So whether that's training, whether patients can log on for a training session or go in person and have someone walk them through the services. Like, I think it would be great if a primary care provider can have certain information detailed to them right away. So what type of house do you live in? Is it detached? Is it an apartment? Are you taking stairs? How many folks are living in your house? Do you have your own bedroom? Do you live in a neighborhood that has a grocery store? Are you reliant upon a food desert situation where a convenience store is where you get the majority of your groceries? All these sort of social determinants of health. Once we get these indicators, we can build them into our healthcare systems, ensure that folks have access to care. I think you'll see a better quality of life for people that have otherwise been left, falling through the cracks of our system.